We would like to welcome today on Immunity Group Australia's podcast a very special guest. We will be speaking with an allergist from North Carolina. Her name is Dr. Nikhila Schroeder, and she's the co founder of Allergenuity Health, which is a specialized allergy clinic in America. Dr. Schroeder, welcome to our podcast.
Hi, thank you so much for having me. I'm excited to be here.
Can I please ask you a very personal question to start with? How did a beautiful, confident woman like yourself choose such a difficult specialization in medicine? Allergy is not the easiest of subspecialties in this field, and dealing with families who often have no choices day in and day out is not an easy thing to do. So, how did this specialty become your passion and why?
Um, well, I actually initially started out wanting to be a cardiothoracic surgeon. So I had the tremendous honor of seeing firsthand a heart transplant procedure when I was in high school. And it was very humbling and it was very just stunning and overwhelming to be able to, be a part of that in some small way and observe. And after that, I always knew I wanted to be a doctor, but then that became what I was planning to do. So I took some turns along the way. I had other things I loved too, and I was an engineer first, actually, and I
Engineer,
loved to
like a
problem.
real engineer, engineering degree.
Yeah, yeah, yes. I have my bachelor's and my master's degrees in engineering. And so I love to problem solve. I love to, figure things out and work on complex things. And I wanted to take all of that to fix the human body somehow or like work on the human body. And I thought being a surgeon and a transplant surgeon, was the way I was going to do it. And to cut a very long story short, I did everything kind of in that aim towards surgery and becoming a surgeon. And at some point, I got very good advice from someone who said, think about your whole picture, who you want to be just in your whole life, and not just your career, and see if that career fits that. And some aspects of being a surgeon, especially a cardiothoracic surgeon, just didn't fit with other aspects of what I wanted from my life, being a mom and just other aspects of schedule, and how I wanted to take care of patients and spend time with them. A lot of things just didn't wind up fitting. And so I changed courses to be a pediatrician and take care of children. And then I wound my way little by little back to the heart and back to cardiology for children. And I was kind of going in a similar direction with procedures for cardiology for children. And I was like, oh, I'm falling back into sort of the same path. And I just started to look at what else I was interested in. And during my pediatric residency time frame, I was seeing a lot of allergy. I was seeing eczema. I was seeing food allergy. I was seeing asthma, environmental allergies. And I was seeing so many children and families that were feeling so isolated. And just, they didn't have options or great ones. And they had to avoid and they had to restrict their lifestyle. And it just sort of broke my heart. And it really tugged at, a piece of me that wanted to, dive deeper and help that specific group of families even more, figure out what we could do. And so I started to just kind of grow in that direction and my interest in helping in that direction. And my friends and I, early on in our careers had joked that anyone who went into immunology was crazy because it is so complicated and we don't even know half of the building blocks yet. And so it just seems like a silly thing to do. It's too messy, it's too complicated. So I was never on my mind to go into allergy immunology at first. And then somehow I wound my way there as I started to work with all of these families who were struggling with it. So that's it wasn't the initial plan. But I'm really glad that this is where I wound up. And I think my engineering background actually, has helped me try to put the pieces together and try to problem solve for these families that can certainly use solutions and some guidance.
I love that story. Life works always in unusual ways and leads us to
Yeah.
places we never planned to be in. Interesting point about pediatrics that you mentioned there. In Australia, it's very difficult to get into to see an allergist, privately included. 6 months is a
Mm,
minimum time. Public system, 4 to 5 years. Obviously, the
wow.
avoidance scenario would create more allergies in that meantime of 4 to 5 years waiting. But what do you think
Right.
is anything missing in the pediatrics training for pediatricians? Because in Australia, the first point of contact for patients are either general practitioners or pediatricians, and many of
Mhm.
them don't have enough knowledge about allergies. Is that the same situation in America in terms of the training for pediatricians, or has it been changed in your experience?
I think it's definitely, improved and grown over time. But certainly I think it's hard. I think being a general practitioner is extremely challenging, right? Because you are the first line, and there's so many things to know. And there are so many different pathways. Somebody comes in with a symptom and it could be several different things. And there's no way that we can expect, like a general practitioner to know everything about everything. That's impossible. And yet it sort of falls on them to at least know something about everything and try to get people to where they need to go, if it's beyond, their scope. And so it is really hard. I think allergy is a lot more complex than it sometimes seems, than the way people want to think about it. We all want it to be much more simple. And in fact, because it deals with the immune system, it's extremely layered and extremely complicated and complex, and not straightforward or simple at all. And so a child coming into the pediatrician with symptoms that sound like they might be allergies is not easy to diagnose necessarily. The tests aren't perfect, and you really have to dive deep with the history, and then figuring out what steps to take is complicated. And so I do, it is hard. I think it's hard for pediatricians and general practitioners, you to keep up with the newest guidelines and things like that. And I don't really blame them either. I think it's just really challenging. So I know that things have improved and advanced as science has advanced, but I think there will just need to be continued efforts to make information available to families so that they're not solely reliant on their general practitioner, and they can work as a team to then together figure out if they need a specialist, or if they can get through things with the pediatrician or family practice individual and kind of educate each other.
You work with food allergy moms and dads and carers every day of your life now. What
Mm-hmm.
happens when a new diagnosis happens? So when a family comes to see you with that desperation, with that shock of their diagnosis, as a specialist doctor, how do you approach new families?
Yeah. Um, it's, I've been doing this with allergies specifically now for, gosh, over 10 years. But I also saw a lot of allergy as a pediatrician, so even longer than during that time. The first thing I do is listen. So I think I find that I learn a lot from that family of how to best help them specifically. If I first let them tell their story. And I also find that it seems to be very therapeutic for them to be able to tell their story and have someone listen. Many of them, it seems, and even some of them have told me straight out that nobody listens to me. Like nobody's listening. I've tried to say this for years and I've been ignored, or I felt this and I didn't know who to talk to. And so they've, again, not only with the allergy potentially been isolated, but even before a diagnosis, sometimes they feel alone. So the first thing I try to do is just get to know them and let them get to know me so we can build trust and we can learn about each other. And so I ask them to share their story. And sometimes that takes 15 minutes, and sometimes that has taken an hour and a half, where we haven't even gotten into some of the more, the diagnostic details or the treatment details, but the family is still recounting their journey and certain traumas they've been through, and how it felt to go through anaphylaxis, and what that's done to their psychological state. Or there's so many different layers to it, and if I don't listen, if I'm shortchanged on that time, like I was in some of my prior jobs, um, I felt I felt for the families because I could tell they wanted to talk. And I felt for me because I wanted to listen. And I think there are other doctors too that would want to sit there and listen, but it does take a long time. And so sometimes people don't have that opportunity. But we've structured our specific clinic to offer several hours for an initial consult. And so we do spend the first good bit of that just listening, and understanding what they've been through. And then after that, we work on, and I can answer any questions you may have about this or that anyone listening might want to know. But then we go through diagnostics, which is also extremely important because diagnosing allergy is complicated and it's not as easy as just doing a test and getting an answer. So we tie together a lot of things to try to get as accurate of a diagnosis as we can, to then be able to go into treatment and management options, of which now there are thankfully several. So we can kind of discuss several different routes and try to find that family their best fit, because that's in the end what winds up being really important.
There is a lot of trauma associated with food allergy life for both carers and children, and afterwards young adults, and when they move into the adulthood. When it comes to food challenges in Australia, it's a very, very long waiting time for that. As I said, 4 to 5 years in public hospitals,
Wow.
privately 6 to 12 months. And there is so much anxiety about food challenges. How do you, as a doctor, help patients navigate that anxiety?
Yeah. It again, I try to just be very honest and supportive through all of these things. So there's a big push in the US right now, and maybe in some other countries too, but because a food challenge or a food exposure through ingestion or eating the food is at this moment our best test to diagnose a food allergy or to test for if someone is desensitized or has some tolerance to a food. Um, there's a big push to doing a lot of food challenges. And I think sometimes that push for that academic information, for that data, is overwhelming to families, and it misses the mark on the trauma and the psychological toll that particular test might take on the family. So you're absolutely right. I see the anxiety with this test all the time. And so we talk about the safest ways we can do food challenges, which is to do it step by step. So we don't just jump into eating a large amount. We start with an extremely tiny amount, and then watch and wait and make sure that went smoothly. And if it did, then after 20 minutes or so, we might give a little bit more, and then again, stop and wait. And then, another 20 minutes go by. If everyone's doing well, then we give more, and so on for a couple hours until we've gotten to a substantial amount. And then we watch even longer while someone is digesting their food to really make sure that everything goes okay. So we explain that to families in detail about how we'll take it step by step, how I'll check on them with their vital signs and look at their skin. And I'm with them in our clinic. I'm with them for 4 hours. So it's their allergy specialist. It's myself. I'm with them for the entire 4 hours. Again, that is difficult. Our clinic is unique. I know that not every allergist can do that. Their employer may not let them do that, or that's just not the time that they can dedicate. So they have other, healthcare staff that might be with the patient instead of the specialist the whole time. But really, if you have a knowledgeable staff, set up to monitor this, we can keep patients quite safe if we take it nice and slow. So we talk about that and the emergency care that would go with it. And I truly don't pressure anyone to do a food challenge. I tell them why it's important to do, like what it would give us, what information it would give us. But I also go through the risks, and I leave that up to each family, because I don't think it's something we should do just to get the information because I want it as the doctor. I think we should do it when a family is ready for that information and feels it outweighs their anxiety or the trauma they think it might cause.
Absolutely. Psychosocial readiness is a key component of obviously our program as well. And
Mm,
it's the families guiding the child into life, and their anxiety can be transported onto the child or transferred and vice versa. So there is that
right.
bilateral relationship when it comes to both happiness or anxiety, we found. When we
Yes.
met in Dallas, we met at the FAST OIT Congress in Dallas a couple of months ago in person. And one interesting thing which I really liked when talking to James, your co-founder, was that every new
Mhm.
family who comes to your clinic gets a free pillow cover. Now that was
Yes.
awesome. And often
Yeah.
people don't understand the importance of managing environmental triggers for immune inflammation. Can you please give us a simple explanation? Why is it important to control environmental triggers? What does it mean? And is this the reason why these pillowcases are very popular for in your practice?
Yeah, absolutely. So I am a big believer in managing allergies comprehensively, um, because it is because of this complex network of things that work together in how the body will handle an exposure. So what I mean by that is the simplest way I'm trying to think of a simple way to explain this. So, when the body is exposed to something that aggravates it, like an allergen, it will mount a response if it's decided to fight that item. And when it finishes its job, when it has its reaction and it thinks it's fought off the allergen, which is not what it needed to do, but that's what it thinks it needed to do. It tells itself, good job. It says, hey, I did it. We did what we were supposed to do. Let's ramp up to do this some more. We need to be ready for a bigger fight. It's called a positive feedback loop. So it does the thing and then it makes sure it can do the thing even more in the future. And so if you are allowing your body to be exposed to your other allergens, so if you have food allergens and environmental allergens, and you're trying to work on your food allergens, but you're leaving yourself open and exposed in large ways to environmental allergens, then when you meet that dust mite, exposure or the pollen exposures, and your body revs up its fight and it does its fight, and you have your sneezing or your congestion or your rashes. And then your body feeds back to itself, hey, we did it. We did a good fight. Let's be prepared to do more. It keeps developing and furthering that pathway. And while that may, to some degree be allergen specific, there's also the general natural chemicals that it releases, the general pro-inflammatory mediators or things that promote inflammation and reactivity that these pathways release as they get ramped up. And so you're then if you're trying to calm things down with the treatment in one area, but you're letting the environmental exposures and reactions go wild in a different area, you're kind of fighting your own progress. So we love to teach this to our patients and then encourage them to look at their whole allergen list, the main things triggering their body comprehensively, and even look at things beyond allergy, things like sleep. What is their sleep, habits and routine? How is their general health? Do they have other medical conditions? What is their diet like for nutrition and stress and all these other things matter as well. So, but from the allergy standpoint, we definitely highlight the other allergens if they have them, and then we encourage them to, we teach them about ways they can try to dampen those responses. So one great easy thing people can do, since dust mite allergy is so prevalent, and even if it's not an allergen for you, it can be an irritant, which still kicks up inflammation in your body, is put a really good quality dust mite protective cover on your pillow and your mattress if you can, but especially your pillow where your face rests for a third of your life. for 8 hours every day, right? And so protect yourself in that way. And so I used to just encourage people to go buy them and give them guidance on that. And after a little while, I said, you know what, this is so important that we are just going to give you, we're going to purchase them. And then we're just going to
Amazing.
give it as a gift to you because, you know, everyone's busy and I understand that. And this way, at least they have it and they can put it on because that's not too hard. And then once they see typically how much better they feel fairly quickly from just minimizing that one exposure, then everything else clicks in with the education we gave them about that. And they are more likely to pursue kind of some of those other steps to protect themselves. So that's why
I
we started doing that and some other things as sort of a welcome package, so to speak, to take some of the strain off of allergies for these families.
You mentioned a couple of really interesting points from sort of the lifestyle medicine perspective, the importance of sleep and rest and diet. Many allergists
Mm,
in Australia, at least, and globally generally, never mention diet and the importance of microbiome. Why is it so
mhm.
important? To an average listener who has never heard an allergist perhaps talk about it, you yourself as an allergist, when you educate your patients, how do you start on that front? Why is microbiome of the gut important to manage
Yeah.
in the future as well?
Yeah. So somewhat similar to what the concept of, you know, why being comprehensive about this, you know, is important. Um, the mucous membrane, you know, any surfaces or any organs in our body play a role to some degree with the immune system and with our immune health. And so our skin, you know, surface is our outer barrier. It's there to kind of keep outside things that are not so good out, right? From the inside, it's a tough barrier that is hard to permeate. And when something does permeate it or get through it, right, our body's ready. It's supposed to start fighting that and keep us safe. And then we have all these mucous membranes that are there to kind of filter things and let certain things through and absorb and assess what's going on at these areas. So that's our mouth, you know, the inside of our mouth, the inside of our nose, our eyes, things like that. And so uh, the inside of our whole GI tract, right? It starts with our mouth, but then it goes down through our esophagus into the stomach and then our intestines. Um, that's our largest immune organ. There's so many immune cells there that interact with so many particles from the outer world. Particles in the air, particles in our water, particles in our food, and the food itself. Um, so as you can imagine, the health of that organ is very important in how the immune system is going to function and how it might see different particles. If it's going to see something and feel like it's in danger, or if it's going to see something and feel like it can tolerate it and it's normal and it needs to handle it. So the microbiome, which is a big part of what's on and within that mucosal lining. Is is so critical to how the immune system functions. And we don't know all of the bits and pieces of that yet. We don't know exactly, you know, what absolutely needs to be there and what absolutely is harmful and what amounts of any. We don't know any of that yet. There's still so much more we need to learn, but we do know it's very important. And so talking about general diet health, what sugar does to the, you know, too much sugar does to the body, or what certain, you know, what's the role of stomach acid, what's the role of enzymes, and how does stress change things at a cellular level? Like all of these things are, I think, really important to at least, you know, some patients love the science and we get into the really nitty gritty details, and other folks at least to have someone mention that, oh, wow, these systems are connected. We really do have to think about this. And so if you're trying to improve your health in this one way with your allergies, but you know, your diet is really poor and you have all these stomach problems and you're not sleeping well, or you're like, it might matter. And we really should think about that too, so that you don't, you know, you do get the result you want, so that you know, don't struggle with getting to where you want to go with your allergies.
And as part of our preparation for today's interview, I did ask some of our community questions about what they think about slit. And slit is something you've been practiced for a long time in America, but it's been almost unheard of. It's a new kid on the block in terms of vocabulary, let alone anything else in Australia. So we had interesting questions over the last couple of hours. What is late? How young or old can you be? And what does it actually do in terms of making a difference in the quality of life of patients? So if you have any sort of interesting patient story you would like to share or general knowledge, I think our listeners would be really appreciative of that.
Sure. SLIT is sublingual immunotherapy. And what that mouthful of words and sounds means is a form of allergy management or treatment that involves using the mouth, basically, specifically the area under the tongue. But it actually doesn't necessarily even need to be that. There are more areas in the mouth that can be used, that I do use regularly, actually. But SLIT is the term that's sort of come about, and that stands for sublingual or under the tongue immunotherapy. And what it consists of, in basic terms, is taking particles of someone's allergens. So whatever that person's body immune system has decided has marked an allergen for them, and putting small amounts of that underneath the tongue in a hopefully somewhat purified way that allows those particles to engage with immune cells that are sitting right there too, that are in the mouth already, waiting at the surface, looking for interaction with whatever comes to them, and they are there to process and send a message to the rest of the immune system to say, hey, this is what I saw. This is what I think about it. Now it's your turn, tag, you're it, right? It's your turn to decide if if we need a response and what that will be, or if we don't need a response, because this is not an issue. And so the sublingual route is really nice for that, because these cells are right there. These immune cells are ready and waiting in the mouth, and we can just put a little drop of a small amount of allergen right there and directly communicate with the immune system. One of the other huge benefits that drew me to this treatment a long time before, even in the US, this is just starting to become a little bit more common in the US. It really hasn't been a major thing in the US. So I was sort of seen as this oddball kind of weirdo that chose to specialize in this over a decade ago, and make this what I learned and offered to families, because it was not what the allergy field taught, and it was not, the mainstream treatment. But the treatment itself with sublingual immunotherapy is so safe and is so easy, which are two factors that I heard over and over again when I listened to those patients who, were hoping for a treatment and hoping for something that they could do to help their child with their allergies or themselves. They wanted to get better, they wanted to improve, but they wanted something safe. Some of them were scared of allergy shots, the injections, and the risks that came with that. Many of them with food allergies were scared of eating the food, right? And the risks that come with that. And so they wanted something safe. And life is busy, and they wanted something easy, right? That didn't take a lot of changing of their schedule. And so that's a huge part of what SLIT is it's little droplets. And because they are so small in dose, they're very safe, but that doesn't mean they can't do a lot. And so they still are very effective. I think you had mentioned some folks asking about age, like what age, is that right? So SLIT can be used in any age. I've found because of its safety, it's pretty much, I tell any patients that there is no age limit. So if you're a baby, if you're an infant and you've been diagnosed with food allergy or environmental allergy, although much more rare at that stage, we can do SLIT, even if you're 6 months old. If you're an adult, we can do SLIT. We might need to do it a little bit longer to see some results than for an infant or a 1-year-old. But that's okay. We can still do something safe and effective and easy if you don't want to do other more aggressive options. So there's really any age it's indicated for any age. Quality of life, I think, was the other question someone had asked. And this is unique for each family, and we have to assess it for each family. So I see my job during those consultations with families as listening and diagnosing, and then helping them find their best fit. So quality of life means different things to different people. My biggest takeaway listening to families is that overall, many families are looking to improve their quality of life by being able to just do more things. So again, unisolate themselves, get out there and be able to, be there with their friends doing something or their family, right? Even if they are not necessarily eating the same food, they want to be there. They want to be a part of it. They don't want to be worried about anaphylaxis, sneaking up on them with a tiny crumb coming out of nowhere, right? Or through the air, something very small. And so just opening those doors, even if they're not fully eating a large amount of a certain food allergen, really improves quality of life. And so I have loved SLIT as an option for families because it is safe, it is easy, it's generally effective, just as same efficacy spectrum as other treatments, to play with. And the treatment itself doesn't generally hinder someone's quality of life because the patient doesn't have to do too much. They just have to put a liquid under their tongue and hold it there. So those are sort of the main things about the treatment. I think that answered those questions. But I'm happy to talk about SLIT more or any patient, stories if there's something you'd like to know or think would be helpful.
I think one of the questions also was about duration. When can I have food freedom and eat unlimited amounts of food with SLIT? So that was one of the main questions which came through as well. Is it possible
Yeah.
to achieve food freedom in unlimited amounts with SLIT? And if so, what is the, from experience, expected duration for somebody to reach that stage?
Yeah, that's a great question. We get asked that all the time, and those other questions all the time. So I will preface this by saying that food freedom is a term that I am not super in love with. I understand why it's sort of becoming more and more of a thing, but I to some degree think it's a little bit misleading to families. Because science is not there. We don't have enough science there yet, in my opinion, to prove food freedom or prove a cure. And so food freedom, just like quality of life improvements and things, I think is very individual to each family, what will mean freedom to them, right? So some families, food freedom means eating large amounts of the food, anytime they want on no significant schedule, right? Which is, in my opinion, what food freedom would mean. Not carrying epinephrine, eating however you want, just like someone who's not allergic can do. For other families, food freedom might be, being able to eat large amounts of the food, but having to still keep to a schedule. Maybe for someone else, food freedom is not necessarily eating the food, but feeling like if they got a large, dose of it or had an excellent exposure, that they wouldn't be harmed. But I think the term itself is a little bit, it's vague, and it implies that there is such a way that any of us allergists could prove to a family that they are in such a status of this food freedom. And I don't think we're there yet. There is no test that we can do at this time that proves to any patient that their allergy is gone. We can't test for memory cells in a clinical, we can't just test a patient to see what their longer living memory cells are doing, and if they're still primed to pump out antibody, right? We don't have these other tests. We have skin prick testing, we have blood IgE testing, we have some newer things like basophil activation testing, and all these, other tests that are up and coming. But they're all small pieces of the puzzle. We don't have a way to prove this food freedom. So when patients ask me that, hey, just like you asked, and some of your listeners must have asked, when do you get to food freedom? What does that look like with SLIT? First, I ask them, what are you looking for? What is that food freedom to you? And of course, we all want to cure. I want to cure my patients too. I don't think science is there yet for me to prove, even if I have cured a patient or if a patient is cured, which I do believe happens sometimes, but only sometimes. I don't think we have a test to prove that. So I would rather teach patients about, err on the safer side and teach patients about improvements and maintaining maybe a remission period or maintaining a more tolerant state, rather than suggest that there is this end point of a food freedom sort of picture. That being said, I absolutely do have patients who have been on SLIT, who have gotten to a point where we do a food challenge. They tolerate a very large amount, a full serving size or more, and then they incorporate the food in their diet. And at some point, we stop the SLIT, and now they're essentially eating the food as I think most people try to define food freedom, right? They're eating it in large amounts, kind of when they want, etc. And so it can happen with SLIT. Absolutely. Okay. So that's one piece of the answer. Those same patients, if they ask me, are they cured? I will tell them, I don't know. Please don't consider yourself cured. You might be, but no one can prove that to you. So I would rather you consider yourself in this wonderful new place, but until we have better science and better testing, please carry your epi. Please consider yourself allergic. You are in this better maintained state, and please be careful. And here's, I tell them certain things we can do to monitor and try to see if anything is slipping out of that state, as best as we can. There are other patients that, will they ever reach that point on SLIT? I don't know. They might, the longer they do it. Some patients might need high doses, and other patients definitely do not. Low doses work just fine for them. So it's really unique and variable. And so I encourage families to think about really what will improve their quality of life, really what's their goal. Of course, aiming for that cure, yes, that's something we'll all, think about and try for. But if that's not achievable, which right now I don't think we should ever think of that as the end goal, what really is freeing to you? And is that just, is that accidental exposure protection, or does it have to be eating the food? And what are you willing to do to maintain that? Because there are strings that come attached to eating the food sometimes too. So yes, SLIT can achieve it. On what timeline? Variable. Sometimes, I don't know, 2 to 3 years, maybe. Maybe shorter, but many families that choose SLIT, I don't think are thinking super aggressively. So even if I tried to offer a food challenge at 6 months or a year, they would say no. So I don't have that data, but a lot of studies have suggested big changes within, 2 to 3 years, 4 to 5 years, certainly. And if people do it longer and use it as a long-term management, we might even see even more robust results, if you let the body sit in this comfortable, easy, managed state for a longer time. So, I know that's a long answer, but I think it's really important because there is this mindset of, my goal is food freedom, because I've heard other people talk about food freedom, and I've heard some clinics claim food freedom. And so I guess that's what I'm supposed to aim for. I'm supposed to aim for eating the food, right? And I would say not necessarily, because sometimes getting to that point of eating the food is worth it for a family, and doing whatever it takes to maintain that is worth it. But sometimes it's really stressful and it's not worth it. And the child doesn't want to maintain what they need to maintain. And then everybody's stressed out. And so I think really being realistic up front about what do you really need to live a good life, and to feel free, is even more important than this concept of food freedom. So that's how I approach it with our patients.
Thank you
Yeah.
for the long answer. I think it explains a lot. And how many foods, one person asked, actually, as we speak, I got that question. How many
Yeah.
how many foods can be combined in a single drop of slate? Like, is there a number of foods that can go into that drop as a maximum?
Yeah, it's so there's it sort of depends. Every clinic is going to have their own way of doing things. So depending on who you ask, you might get different answers. I've done a lot of it. This has been my specialization. So I have lots of ways to personalize it to what the patient needs. We have many different versions of this. But if there is truly a patient who is polysensitized, they have had trouble with a lot of different foods, and we need to work on a broad spectrum of things. Depending on the dosing we choose, and what we're prioritizing, I don't know, I think probably the maximum that I have in somebody's is maybe 20 foods, but I can also do environmentals in a different bottle. Now, most people don't truly have 20 significant food allergens, but there are some individuals who have they're just so sensitized and they have a lot of things, and maybe to get better answers they need food challenges, but they refuse, they decline doing them. And so we're a little stuck in teasing out what we need to work on. And so the nice part about SLIT is it is flexible. So I can treat for one thing or 3 things or 10 things or even 20 things in one bottle, so to speak. And then if I want to do environmentals also in a second bottle, for example, then I have the same flexibility there, all from tiny, tiny little droplets. So there's a lot of variability, and we work with each of our patients to just match it to what their priorities are and their goals are.
Can I also ask you about Xolair? I mean, in America, it's
Yeah.
been used for almost 15 years off label for food allergies. So there are
Right.
allergists in the US for a very long time. In Australia, it's only approved for asthma. In the UK, there is a whole, discussion about approving that for food allergies. In the
Mhm.
US, actually, some allergists wouldn't even consider treatments, whether it's LIT or OIT, without Xolair. What's your experience with Xolair or similar type of drugs?
Yeah, I used Xolair more when I was working at in the hospital system and University of Virginia. At that time, it was not approved for food allergy, but we were using it for asthma or chronic urticaria or things like that. And but from the beginning, once we knew the mechanism of Xolair, it's kind of silly because that it has the potential to work with any type of IgE mediated issue, because that's what it does. It binds with free floating, this antibody, this protein floating in the system that has the potential to work with other cells and create allergic reactions, right? And so it has the potential, it binds to that and kind of blocks it from doing what it does. And so it can work for food allergy. And we science knew that decades ago. It's kind of silly that it's not available in some places yet, and it's fairly new in the US too for that. So my thoughts on that are, well, we certainly don't need to use it for SLIT to be tolerated. So SLIT is so easy on the system if done well and matched correctly with the patient, that I don't find that I need to add Xolair simply to have the patients tolerate the treatment. Most patients tolerate SLIT very well. The main side effect is an itchy mouth sometimes, but if you work with that and tailor your treatment properly, I don't have, most of my patients do not have an itchy mouth. Certainly not after the first couple doses where we figure things out if they did have it. So we don't need Xolair to help tolerate SLIT. I do know some of my colleagues like to use Xolair now in addition to doing oral immunotherapy, which is the eating version of the food, right? For the treatment. So sometimes that version has more side effect potential, and some patients struggle with it. And so Xolair can be a really nice addition to that treatment, to help reduce the side effects of that treatment so that more people can tolerate their buildup on that. So that is definitely, I think, a nice use for it in the United States. And then, of course, there's also using it on its own, right? Just to dampen the system a little bit and therefore potentially raise someone's threshold to what they can tolerate. So while I think it's a useful option, I think it has some drawbacks. I mean, there's a side effect profile people need to think about. It's an injection. So it's a kind of painful one too, from what I've heard from patients. So there's that, and you have to do it, regularly. And doing an injection that's painful regularly is problematic for some. It makes testing with blood numbers impossible. You can't really, use them anymore to try to help diagnose or help track anything. So that's really challenging to know, well, what are we doing with this? How can we monitor? So, that can just get tricky. That wouldn't be a reason not to use it, but that's just a challenge. But it's extremely expensive. And so, it's thousands and thousands of dollars per injection. So only people who can get their insurance to approve it really can be on it. And so that brings up the question to me for patients is, well, how long is someone's insurance going to approve it? And so if someone chooses Xolair and only Xolair, and they do that for maybe they're, young and they do that for 5 years and then their insurance does not approve it anymore, or they switch insurances and they can't get coverage. My worry is that if they didn't know about OIT or SLIT or some of these other options that can actually communicate with the immune system and potentially change it for the better over time, then they've missed a beautiful window to actually interact with the immune system in a way that could provide longer lasting change by using this other injection treatment that, as of right now, we don't think has that kind of effect. So that's my only concern. That's my biggest concern with it. And again, each family has a different thing that is a good fit for them at any given time. So we try to educate them and say, here are all the things, here are the pros and cons of each one, which one fits with this stage of life for you. Because that's really, I think, what it's about is what works for you right now for some number of years, and then reassess, right? And choose a different tool or keep going with that same tool if it's the right one.
I love our discussion that you brought together all these concepts of consent, which is often missing from the most medical approaches, at least in Australia,
Mm.
partnership with families, communication, so psychosocial aspects, and reevaluation. Often people think that either OIT or SLIT is a one moment in their life and they can go on in a different
Mm-hmm.
way with their life, but that reassessment, it's important, as you mentioned. It's constant communication changes in the immune system which have to be reassessed, and I don't believe that people understand that part of science.
Yeah, I try to start the educational part of every one of our consults with reminding, or maybe for the first time, a patient might be hearing that allergy is a chronic health condition. It is. I don't love saying it. I don't want to have to say that to a family, but it's something that a family needs to hear and to understand the reality of the situation. Just like diabetes, just like needing to wear glasses if you can't, if your eye, if you have myopia or something where you can't see as well, right? There's so many things that are chronic health conditions, and on the one hand, I never want to take away the seriousness of it because it is absolutely serious and it can be devastating to get news of any chronic health condition, right? And to have to grieve that a little bit and understand, okay, this is now a part of my life. And oh, I wish I didn't have this, right? Of course, I wish they didn't have that. I wish I didn't have, I mean, I have allergies myself. Like, I wish I didn't have allergies. I wish I didn't have, swollen ankle right now from something that I don't know what's going on, right? We all don't want our health conditions, of course. Um, but to some degree, almost all of us, at least at some point in our life, we all do have health conditions to deal with, many of which are chronic. And it doesn't have to define us in a bad, it certainly doesn't have to be this big part of our life that drags us down. It can be a part of us, and just a part of us. Like, I put in my contacts every morning or wear my glasses, right? And yeah, I wish I could open my eyes when I wake up and just see. That would be lovely, right? But also it's okay. I know what I need to do. I know that I can't drive unless I have some sort of help with that. So I need to get my contacts in, or if my eyes are hurting, I need to put my glasses on, right? And I have gotten into a routine, and I know I need to do these things to be safe and to be able to live my life. And so I try to work with families to get them to accept that it's a chronic condition and there's really not an end point. There just isn't. You might be in a remission. There is a small chance of a cure with current science, but we don't have a way to prove who's cured and who's not. So let's kind of not aim for the thing we can't prove just yet, except for scientists. Yes, please go ahead. Scientists, go ahead and keep trying for that cure, right? But for the patient, okay, don't get depressed if we can't cure you. Let's work with this chronic condition to improve your quality of life and make it not feel like it defines you. Make it just be, okay, a part of who you are. You don't eat this one food in large amounts, fine, right? Of course, we want you to be safe. How can we get you safe? Let's figure that out for you so that you can go on that plane, so that you can go on that trip or be with that family or sit with your friends at school, or do that sport or whatever, do those things, right? And just do them with allergies, right? And so that's I think a big part of this whole medical condition that maybe isn't talked about enough, in a way to help families work through their grief with it and with just having to deal with the pesky chronic condition, to say, okay, well now, okay, I got it. Ugh, now what are we going to do, right? And accept it and move through it in a positive way. So I like to bring that up and sort of be that bad guy maybe at the beginning to say, hey, we really need to talk about this. No, I'm not going to tell you I'm going to cure you in 3 years. Like, that's not a thing anywhere, really. And so let's talk about what this means lifelong. And we don't have to have all the answers lifelong right now, because just as you mentioned too, Nina, like, things are going to change, right? You're going to go through puberty, if they're young enough, you're going to grow, things are going to change. You're going to have puberty, you might have children, you might move, you're in different environments, you're going to have stressors, you're going to get sick, etc. So we don't know what the future brings. Let's just understand that this is going to be there to some degree all along, and let's work with that to give you your best life. So
I love that. There are
helpful.
options. There is options at least to make a person safer. There is
Absolutely.
sleep, there is OIT, there is biologics. There are more, talks about, this and that potential new innovative approach. But we're very
Yep.
grateful to have people like yourself talking to our audiences, educating and providing hope, because that is what every food allergy family needs: hope and better
Absolutely.
information.
Absolutely. And there's absolutely reason to have hope. There are so many great ways to approach this now, and just getting that education information, learning about all of your options, and then finding that right fit is is just such a wonderful path forward for these families. So I hope I was able to help a little bit today, and thank you so much for having me on with you.
Thank you. We hope to see you again.
Likewise.